Hi, I'm Dr. Deepa Abraham. I'm an ophthalmologist with glaucoma subspecialty training. I work at Milauskas Eye Institute. Glaucoma is a characteristic pattern of damage to the optic nerve. So just to refresh your memory, the optic nerve is in the back of the eye. It's like an electrical cable that connects the eye to the brain. So all the information that the eye receives and processes goes via the optic nerve to the brain. Glaucoma is kind of a heterogeneous group of diseases, so sometimes it's a family history that leads one to developing glaucoma, sometimes it's a history of trauma, sometimes it's medications such as steroids that cause elevated eye pressure and cause glaucoma. So there's not one easy answer to what causes glaucoma. Yes, glaucoma can be hereditary, so I always tell my patients with glaucoma to be sure and let their family members know to be screened for glaucoma. I did that again. Sorry.
Yeah, go ahead.
So, glaucoma can be hereditary. I always tell my patients who have glaucoma to be sure and let their family members know so that those family members can be screened for glaucoma when they go in for their regular eye checkups. Yes, in fact, children can be born with glaucoma, so it can happen at any time of life. The most common type of glaucoma generally presents in older age. Are glaucoma and high blood pressure related? Not in a one-to-one fashion, so that if your eye pressure is up, it doesn't mean that your blood pressure is up, or if your blood pressure is up, it doesn't mean that your eye pressure is up. But the optic nerve is an organ just like your kidneys and your brain, and so it needs to have a good blood supply. So treating blood pressure is important to maintaining the health of your optic nerve. Glaucoma has a variety of symptoms. Most commonly, it has no symptoms. There is a specific type of glaucoma called angle closure glaucoma, where the pressure can go very high. People can have vision loss with pain in the eye, but the most common type of glaucoma, open angle glaucoma, has really no symptoms. So you don't feel like your vision is blurred until very late in the disease, which is why it's important to be screened at your regular eye checkups for glaucoma. So if you go back to the fact that glaucoma is damage to the optic nerve, the optic nerve is made up of lots of what we call nerve fibers. Each one of those nerve fibers takes information from a certain part of your vision. So some of it is from your peripheral vision, some of it is from your central vision. In glaucoma, those nerve fibers get damaged, and then you can have sections of the vision that start to become more blurred. And that's what we're looking for. And at this point, we don't have a way of reversing nerve damage, so it's important to catch it early so that we can minimize any further deterioration in vision. How quickly should patients seek treatment if they have angle closure glaucoma? It should be as soon as possible. That's the most common reason why I'm called to the emergency department, is because someone has elevated eye pressure with pain. So go to your closest healthcare facility if your ophthalmologist or optometry office is not open, because time is of the essence. Glaucoma is treated by lowering the eye pressure. So whatever your eye pressure is, we try to keep the pressure lower than that and follow the optic nerve to make sure that it is staying stable and you're not getting further damage from glaucoma. Some people think that if you have a high eye pressure, you have glaucoma, but it doesn't work that way. It's really the diagnosis of glaucoma comes first, and then the eye pressure is lowered as a result of being diagnosed with glaucoma. So not at this time, but we are very successful at maintaining the vision with the treatments of lowering the eye pressure, either through laser surgery, eye drops, or other types of surgeries in the operating room. At this time, once you have the diagnosis of glaucoma, you need to be monitored for life. And treatment is something which is tailored to the patient. You know, if it's a mild glaucoma and there doesn't seem to be any vision loss, the treatment is tailored accordingly. So not everybody has to take medication or have laser or surgery for glaucoma. It all depends upon the severity and the whole clinical picture. So glaucoma is treated by ophthalmologists and optometrists. So really there's quite a wide range of severity in glaucoma. So depending on how severe your glaucoma is, you might need a glaucoma subspecialist taking care of you. So a glaucoma specialist is someone who has done a fellowship in glaucoma. So it's after the 4 years of medical school, the 1 year internship, 3 years of ophthalmology residency, and then an additional year of seeing only glaucoma patients and doing glaucoma surgery and further studies in glaucoma.